line right now, as we do every other Tuesday, Dr. Jaimie Ronchetto from Cinema Vet on Cinema Drive. Good morning. Happy rainy Tuesday.
Good morning.
So what is happening with you, Doctor?
We've been very busy over at Cinema Vet. Dental Health Month was in February, but ours has definitely carried over well into March. We've been very busy with doing dentals for our dog and cat patients that need it. So I thought that would be good to touch on a little bit, just as a reminder.
So what exactly, dental health? Now, this seems like a very tricky situation because when I have to give my dog medicine, that is, it's supposed to take seconds, but we have to trick the dog. We got to trick the dog into, we got to wrap it in something or peanut butter or one of the pill pockets. And so how do you get near an animal's mouth without them flailing all around in order to do some dental work?
Yeah, that's a really good question. Certainly for our initial exams, with their pet parent to examine their mouth, most animals will let us do that pretty easily to get a good idea of, the level of their dental disease. We try to stage it a 1 through 4 as far as dental disease. How much calculus do they have on their teeth? How much gingivitis? If there's a smell or anything like that, so that we can get them an estimate for the dental procedure, which is the cleaning, so scaling all the teeth with the ultrasonic scaler, doing a more thorough oral exam, taking dental x-rays, and then if there's any extractions or any other therapies that we need to do for the teeth, if there's any problems, then we can handle that. So for that type of procedure with the cleaning, the x-rays, extractions, the pet is sedated. So we put them under anesthesia, and so that way we can be monitoring them closely the whole time. They are not going to flail or be stressed because they're just taking a nap, basically, and we can get done everything that we need to get done. So
is it
win-win.
Is it more of a twilight, like when you go in for a colonoscopy, or is it full on see ya, nap time, you are out?
It's a full anesthesia, so we intubate them, so we have control of their airway, and that's safer for them with the tube in, because there's no way that they can potentially aspirate any water that we're using or any of the agents that we're using in their mouth. And yeah, they're fully under, so that way if there are any extractions, that wouldn't be enough for just a twilight either. They need to be fully under, because that can be obviously painful for them. So we want to be able to manage that, do any kind of local blocks to help manage the pain so that they don't feel it and that they can recover easier.
What are the best age ranges for something like this? I can't imagine that a puppy would need it, but then we get into a senior dog, and I believe there might be some worries about putting a senior dog under. So what's the age range for these types of dental procedures?
Yeah, we do dentals on all different ages, so there's no, certainly the most common would be middle-aged and up, excuse me, but we do dentals on all different ages, and certainly there is always that worry with putting the seniors under anesthesia, and is it safe? But we always do full exams first. We listen to their heart. We make sure there's no arrhythmias or murmurs. We do full blood work, make sure there's no issues with other organs internally that would make them at an increased risk for anesthesia. And we use very safe anesthetic agents that they recover quickly from. So typically our seniors are doing very well. They may take a little bit longer at home to fully recover, so they may be kind of groggy for a day or two, a little bit slower to kind of get 100% back to normal. But for the procedures itself and the anesthesia, they typically do very, very well.
What can we do? So I'm going to paint out a little scenario. We get a puppy. We adopt a puppy at the shelter. We kind of don't know any history about whether they've had dental work or, if they need it. At that point, where do we begin at-home care, at-home oral care for, let's just say, the dog? Let's just say a puppy.
Yeah. Brushing is best. So with any, especially puppy, if they're truly a puppy, a young dog, training them, getting them used to not only just, having their paws touched, their ears touched, make sure that they get used to having their mouth touched and having like a toothbrush or a little finger with a finger brush over it in their mouth to help clean their teeth. Baby steps, certainly, because you're training and they need to get used to all the weirdness that goes with that and the weird feeling. But, if you do it in baby steps incrementally over time, then they will be able to tolerate it better. Usually the doggy-specific toothpaste that we want to use that are safe if they swallow it are flavored. So many times it becomes like a treat for them. That's just a flavored treat that they get to kind of lick and chew on the toothbrush, which, still will do its job if you're able to get in there at all to scrub some of the teeth that are touching the cheeks. And a little bit of the chewing from them is fine too. And if we can work up to some sort of routine where you're doing that on a consistent basis from the get-go, always helps, because then you're taking away that soft tartar consistently so it can't build up.
But there's no way to floss. Is there?
No, you're not going to be flossing.
Okay.
No.
All right. I just want to make sure, we're covering all the bases. Now, when I used to brush the teeth for my pup, the toothpaste that they sold me was peanut butter flavor. Now, I'm like, what? Because I need a minty, like my mouth, I need mint. I need to feel clean and fresh. I guess a dog doesn't worry about that. All they care about, if it's in the mouth, I want it to taste good.
Right, exactly, yeah.
So what other flavors are out there besides peanut butter? Or is that the fave? Is that the fave?
There's chicken, there's vanilla, so that's usually a popular one because it's a little bit sweet. It's not like a savory smell, so the vanilla is a good one. I don't think there's really any mint because I don't know that animals would appreciate the mintiness like we would.
Okay.
So I think there's like a malt flavor too, which is pretty neutral, so maybe going with something like that.
How do you feel about the dental treats that are supposed to help with the tartar?
I definitely think they help to some degree. Brushing is certainly best, but for those pets that won't allow it, the dental chews, anything that will actually make them chew and not just like crunch, crunch, and swallow.
Right.
But if they're going to take some time with it and chew it, then that certainly would help as well.
We are speaking with Dr. Jaimie Ronchetto from Cinema Vet, located on Cinema Drive. The number is 253-9300, 253-9300. Take care of your pet's teeth as you would your own teeth. That is the best path to longevity, no diseases, and plus, they won't have the puppy and dog breath. Always a plus. Always a plus. 253-9300. Dr. Jaimie, thanks for spending some time with us today.
Thank you. Have a great day.